I'm
Hello,
Haarika.
Harika.
Hi, Dr. Mohammed.
So it's nice to
I,
meet you. This is your patient on the screen. You can see. So you can go ahead, please.
it's nice to meet you too. Is it okay if I ask the patient a few questions?
All right, please go ahead.
What
Kana so
is
ta
the
dan miki
patient's
tambayoyi.
what is the patient's name and age?
All right, me sunanki kuma shekaranki nawa? Hello, can you hear me, Harika?
Oh, I couldn't. Did you say something before that? Yes, I
Can you
can
hear
hear
me
you.
now?
Yes, I can hear you now.
Yes. Her name is Rukaiya Hassan, and she's 20 years old.
Okay.
Yeah.
Um, can Rukaya Hassan tell me a little bit about her family and what she does on a day-to-day basis, like if she works or if she still attends school?
Okay. Zaki iya faɗa mata wani abu a kanki ko kina da aure ko kuma kina da yara ko aikin me kike yi? All right. She said she's married. She has a daughter, and she is not gainfully employed.
Okay.
Yeah.
What brings Rukaya Hassan in today?
All right. To me ne sa kika zo asibiti me yake damun ki? All right. So she said she is having fever, headache, and body weakness.
Okay. How
Yeah.
long ago did these symptoms start?
Yaushe kika fara jin wannan rashin lafiya? All right. She said she's been having these symptoms for about 3 days now.
Okay.
Yeah.
Um, could you please ask Rukaya Hassan to describe the fever and ask if it's continuous or if it's on and off?
So wannan ciwon yana zuwa ya tafi ne ko kuma yana nan kowane lokaci? Okay. So the fever comes and go, and it's more in the evening.
Okay.
Yeah.
And can you also ask Rukaya Hassan to describe the severity of her headache, if the pain is in one spot or if it's more generalized?
So ciwon kai din nan wani bangare ne a kai din naki yake yi ko kuma yana hana ki bacci ne ko yana hana ki wani ayyuka saboda ciwo? Okay, amma ta wajen wani bangare ne kan yake ciwo? Duka. All right. She said it's a generalized headache, and it's not that severe enough because she can do her day-to-day activities.
Okay. Can
Yeah.
I please take Rukaya Hassan's temperature?
As her temperature checked is 37.9 degrees Celsius.
Okay, that's not too bad of a fever right now. Um, can you ask Rukaya Hassan if she's experiencing any fatigue, dizziness, um, anything like that?
Okay, kina jin kaman ko hajijiya ko kuma daga kin ɗan aiki kaɗan ki ji jikinki ya mutu gaba ɗaya? Mm. Mm. Okay, yanzu ba kya jin? All right, she says so. There is no any dizziness, and but she has body weakness, but not but there's no dizziness.
Okay. Can
Yeah.
I check for paleness in her palms and under her eyes?
Yes. Ki ɗan nuna mana tafin hannunki hakan nan. So you can see the palms is not that pale, and bari mu ga fuskanki. As you can see, the conjunctiva is not that pale. Also, it's pink, so she's not that pale.
Okay.
Yeah.
Is Rukaya Hassan experiencing anything like abdominal pain, chest pain, runny nose, coughing?
Okay. Kina jin ciwon ciki ne? Okay. Akwai majina a hanci ko tari? All right. So no abdominal pain, no cough, no runny nose.
Okay.
Yeah.
I suspect that Rakaya Hassan has malaria, and she might have slight, some mild anemia as well. So I'd like to do a rapid diagnostic test, and just to be safe, I'd like to also do a full blood count.
Okay. So rapid diagnostic test for this patient revealed two pluses of malaria, and the full blood count reveals the hemoglobin level is 13 grams per DL for this patient, and blood culture also did not yield any bacteria.
Okay.
Yeah.
So the patient is actually has very good hemoglobin levels. So she doesn't
Okay.
have any anemia, meaning that she has uncomplicated malaria. And
Okay.
I'd like to treat that by doing a ACT treatment, an oral ACT treatment, like coartem. And
Okay.
for future prevention of malaria, I'd recommend that she wears long sleeves to prevent. So for future prevention, I'd recommend that Ruqayya Hassan wears long sleeves as well as bug repellent and maybe investing in some bug netting to prevent mosquito bites, as well as not staying out too late, especially when it gets dark to prevent mosquito bites as well.
That's great, Harika. You did well actually. From the symptoms of this patient, you were able to know that she has malaria, and you did your RDT test to confirm, which shows two pluses of malaria. And yeah, you did well by trying to rule out anemia. Even from the examination, you tried to rule out, which is very good. And the investigations also hemoglobin levels, even though she doesn't have, it's good that you try to rule out anemia. And you also suggested the correct treatment for this patient. Uncomplicated malaria, we give oral ACT, not IV. So you did very well there. And you also did very well by mentioning the future prevention so that this patient should not come back having fever again in the future. Long sleeves and long pants, and also mosquito repellent creams, which is very good. So you've done very well, Harika. Congratulations.
Thank you. Thank you so much.
Yeah. So yeah, thank you. Tana gaishe ki wai. So she said you're welcome, and she's also very grateful for what people have done to them. And she, yeah, you're welcome.
I was glad to be of help.
Yeah.